I think we can get on that first slide and we'll get things going. All right, so thanks so much for coming here today. We're going to be talking about our program INDEPTH, how it's combating youth vaping as well as other tobacco products, and kind of what you guys can do to be a part of it in Arizona. All right, so if you could, I think we have a group the size that we could actually come on and share. Last time I think we had you share in the you know, with the notes section, but let's go ahead and hop on, and if you could share your name, what school or health department you're with, and then today's National Fairy Tale Day. So what's your favorite fairy tale?
And if you're more comfortable putting it in the chat, you're welcome to do that as well. So now I see we got a bunch more people popping in.
Yeah, it almost doubled in the time that I said that.
Right. This is our way of taking attendance. So if you don't mind popping in one way or another, we'd appreciate it. And then the other thing that I'll ask, unless you are going to share individually, is to make sure that you are on mute so that we can avoid background noise, unless you're going to share your introduction with us. All right, Brian Dennis from Pima County, thank you. Welcome, it's good to have you. And Berenice, I hope I said that right. And Jen. Jack and the Beanstalk, that's a good one.
I was just typing the same thing.
I was going to say Cinderella, but for not any particular reason. Andromeda, welcome. Tyler. Got lots of Jack and the Beanstalk fans. That's awesome. Very fun. Hi, Jan, welcome. There's Jen. Cinderella, yay, there's another Cinderella. All right, we got a Peter Pan. Hi, Ray, thank you. Alexia from Yuma County, thank you for being here today. The Six Swans, okay. And Noelle, I'm hoping I'm saying that right. Thank you for joining us. I see several names that I've seen on the pre-survey, and we're going to talk about that a little bit down the line. So it's wonderful to have you here. So glad you could join us. Patrick, why don't we go ahead and get started, just so that we've got enough time to answer questions at the end.
Absolutely.
And Denise.
All right, so this is just to let you guys know that all references to tobacco and tobacco products within this presentation refer to commercial tobacco and nicotine products, and not the tobacco and or other plant mixtures grown or harvested and used by indigenous people for their sacred purposes. All right, so today we're gonna do an in-depth look at INDEPTH, talking to schools about alternative to suspension, what to know to grow, resources, technical assistance and support, and moving forward, what to do next.
All right, I will take it from here. And at the very end, thank you, Patrick. At the very end, I'll make sure you've got Patrick on the line. We also have Alyssa on the line as well. And I'll make sure you have our contact information as your technical assistance support team. So you'll have our contact information at the end of the slides. We will be sure to share a PDF of these slides with you at the end. So if you need them to reference back or you need hyperlinks that are in there, we'll make sure that you get those at the end, as well as a link to the recording. So that's usually one of the questions that pops up early on. Can we get copies? And yes, you can. Happy to provide that. So a couple of you may have already watched the first recording or perhaps even participated on that first call that we had about a month ago. So I just want to set the stage a little bit. I'm going to try not to repeat myself, although when we're talking about in-depth, I want to set the stage for as you are implementing the program or looking to implement the program, more of a focus on the how-tos. And less so on the program itself, like we would have covered in the previous session. So if you want a refresher and go back and watch that, I would encourage you to do so if you did not participate in that first call, so that you have that kind of baseline foundation knowledge. So today, just want to share a little bit about, again, the hows and the whys. So there's a lot of research out there right now supporting alternatives to suspension. One of the primary go-to places that I like to reference for folks is the Public Health Law Center. They've done a tremendous amount of background and research on alternatives to suspension, specifically related to vaping. So looking at more of a restorative justice approach rather than a punitive approach when it comes to how we are addressing vaping in the schools, because we know if we are addressing the student and the behavior and looking at the ultimate reason why students are starting to use, we've got to focus on who's at fault. It's really the tobacco industry that has targeted our youth. Rather than penalizing the student, we want to give them the education and resources and provide an opportunity for an intervention and help them to live a healthier lifestyle. So rather than punishing them and removing them from school or suspending them, our guidance is that you offer an alternative to suspension and education program like INDEPTH. And so that's what we're here to talk to you about today. So this graph just shows the Lung Association's comprehensive approach to addressing the youth vaping epidemic. And I'm not going to go into every single one of these tiers today. We'll focus a little bit more so on the policy piece slightly, and then much more so on the intervention piece. But this is a great graph to kind of show that it's a comprehensive approach. It's not just one piece. Although we'll be focusing on one piece primarily today, it is a part of a whole process that should be addressed. And then I want to mention within the in-depth program, within the training, we do include a Vape-Free Schools Initiative tobacco-free policy assessment, and you see an image of that on your screen right now. This is an opportunity for schools to just take a look at what their policy looks like. Is it comprehensive? Does it include components of enforcement and everything from prevention to intervention to cessation? Does it approach working with students as well as staff, as well as the community in which the school is in? So it isn't, there's no, you have to have such and such to participate in INDEPTH, but we really have found that for schools that take a serious look at their policy and have some of those foundation principles in place, they're going to be much more successful when they implement intervention or cessation programs. And so it kind of makes sense to kind of start at the beginning, but we recognize that policy change can take time. And the folks that are at the table for offering an in-depth program, for example, may not be the ones that are ultimately making the decisions about what those policies are. However, they should be informed about knowing, what a solid policy looks like and what should be included and how it should be communicated and all of those pieces. And they can share that information with others that might be interested as well. So for those of you who have not gone through the in-depth training, I encourage you to do so. This is just one module or one component of that training that walks you through the pieces of the policy. In addition, it's important to to give thought to not only the policy, but how that policy then relays to the students through their code of conduct, through their extracurricular activities, through, all of the aspects of the student in the school environment. So it's more than just what the policy is, but how that is enforced and how it is communicated as well. So I'm happy to, and I didn't mention this earlier, but I've got intentionally left some time at the end of the presentation today for you to ask questions. So by all means, you are welcome to put your questions in the chat right now as you think of them, so you don't forget until the end. But I welcome any of your comments, feedback, questions throughout. So feel free to add those to the chat as we go. So I'd like to dive in a little bit deeper into the INDEPTH program. So the American Lung Association's INDEPTH program, it's a long title, but it's Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health. And that's a long title, but that's why we just call it INDEPTH for short. It is the Lung Association's Alternative to Suspension program. It actually was created as part of our Not on Tobacco program over 25 years ago. We actually called it Alternative to Suspension. And it was created because we found a lot of schools were saying, we don't know what to do with these students that we're catching. They're not ready to quit necessarily, but we need something for them. And so about 5 years ago, we took a look at that curriculum, modified it to be more focused on vaping as the current need is, and then to update some of the content so that it was more relevant to today's situation rather than 25 years ago. So the program has been around for quite a while. And it is intended, as I mentioned, for students who violate school tobacco policy. So while we say it's prevention, it really is preventing them from becoming addicted in the future or further addicted. That's the prevention piece of it. It's really not intended to be all applies to all students kind of curriculum. It's for those who have been caught or who have violated school policy. It is targeted primarily for the school setting. However, it can be offered in partnership with community groups that might be willing to partner with the school to offer the program or to support schools, because we know lots of folks have limited capacity and bandwidth for offering programs like that. So it's for schools and other youth serving organizations or community partners. And underlying all of this, and I'll mention this several times throughout, well, the emphasis, it does address vaping because we know that's the top use of tobacco products by our youth today. It does include information on other types of tobacco because we know a number of students are using not only tobacco, but not only vaping devices, but they're using other types of tobacco as well. So it's important that we include that. So the overall content is to help students understand about nicotine dependence and what they can do about it, and recognizing the steps to take when they are ready to quit. So it isn't a quit program necessarily. We do encourage them to set a quit date to take action towards that. But it really is, after a student has offended a school policy, their tobacco-free policy, and now what? What do we do? So it offers an opportunity for them to explore the harms of tobacco, what they can do about it, understanding that they may in fact be addicted, and if they are in fact addicted and ready to quit, what can they do moving forward? So the evaluation that we have done on the program thus far, we have found anywhere from 60 to 80% of the students who participate in the program are ready to quit or to start the quit process at the end of the program. So that's kind of our bar that we set for students who participate, is expecting that most of them will want to take the steps and plan to make a quit plan upon completion of the program. So who is the program for? It's intended for middle or high school students who have violated policy. And I want to take a moment here to pause, as we've are hearing more and more that we get some students who maybe aren't in middle school, or we've had elementary schools that have combined with middle schools. And so, at what grade is it appropriate for them? The curriculum was written and has been evaluated for middle school students, so roughly 13 to 18. However, myself I'm a certified tobacco treatment specialist as well as a certified health educator. I hate the thought of saying that a student is too young to participate in this program if they clearly are using tobacco and are clearly needing some kind of intervention. So if a student who's in 5th grade or 4th grade, and I've heard even as young as 3rd grade, if they're coming in with vaping devices and they're being caught and they're showing signs of addiction, why would we wait and say you have to wait until you're in middle school, you're not eligible yet? So that being said, the program is written at a level for slightly older students. So there may need to be some modifications done by the facilitator to help support a younger student who might need to participate. So all in all, though, it is ultimately primarily for middle and high school students. The intention of the program is that for it to be mandatory. That is, although we say it's an alternative to suspension, and we will ask students, why were you offered this program? It really is intended you got caught. And so the consequence is that it's like a diversion program. You have to complete this program to meet the requirements to fulfill whatever, because you violated the policy, whether that's extracurricular, whether that's instead of a suspension. But it's intended to be mandatory, not optional. If they want to take it, they can. If they don't want to take it, they can't. It really is intended to be the consequence, the response of the violation. And as I mentioned, it's not intended to be a prevention program for all students, for anybody. It is really intended and written towards students who are currently using. So if you have students who aren't using at all, it isn't going to be relevant for them. So it really is meant for those who are current tobacco users. So the structure, we have 2 different modalities of the INDEPTH program. One is an in-person program, and then one is online. And the content for both of them is basically the same. It's structured in a slightly different order with the online version. And the in-person is facilitated by an adult, whereas the online version is self-guided by the students. And I'll explain a little bit more in the upcoming slides, but ultimately, there are 4 modules or 4 sessions. Each of those sessions, for the in-person anyway, takes about 15 minutes. Those sessions can be combined in all one session or in 2, roughly 2-hour sessions, or they could be split down even further if need be. We've had some schools who have offered it just in a one-on-one setting as opposed to a group setting. But so the bottom line is it's really flexible in how it's implemented. The in-person program is intended, as I said, to be presented by a trained facilitator. That program can also be offered virtually, so students can participate either in person in a group or virtually in a group, or one-on-one if need be. So on the online side of things, it's a separate process. It's available at indepthonline.org. So you can go there to check it out. There's some FAQs and some information about the program. Kind of 2 things happen on this site on indepthonline.org. The first one is it's the organizational or site administrator portal. So it's where somebody who's going to make the referral for the student to participate in the program, that's where they sign that student up and make the referral. The student is then sent an email to register and begin the program. Also on that portal page, it allows the site administrator or the facilitator to monitor a student's progress. So they can see there are 4 modules they need to complete. They can see whether a student has completed 25% of the program or 100% of the program and has, received their certificate of completion. On that same site, indepthonline.org, is also where the student activity happens. So once a facilitator makes a referral for a student, the student logs on for the first time, creates a username and password. Their username is usually their school email, or it could be a personal email address. They set up their password, and then they begin the program. For those of you who might be familiar, it's very similar. It's set up in a very similar format to the Not For Me program, which is our online cessation or quit program, which would actually come after In-Depth Online. But if you are familiar with it, it's a very similar format. As I mentioned, it's self-guided, it's online, so students do have to be connected to the internet. There's no download or there's no app that's necessary for them to participate in the program, but they do have to be connected. At the end of the program, they do receive a certificate of completion once they have completed all pieces of the program, and that includes the final survey. And then also built into the program is referral into a quit program like the Not on Tobacco or Not For Me program. And there are other cessation resources, of course, that are available and can be shared with the student as well. So I always say it's kind of like you can lead a horse to water, but you can't make it drink. The whole purpose of the In-Depth program is kind of like making that horse thirsty. We're trying to get those students to be ready to quit, and we want to make sure that there's water available for them. So it's very important, regardless of what the quit programs that you have available, that you do make sure that that's a piece that's in place. And again, going back to the policy review, looking at what are our available resources in our community, that when a student goes through this program and says, you're right, I want to quit, but I need help. Where do I go to get that help? It's important to make sure that you have a plan for that in place. And if you have that comprehensive policy, you likely have that plan. So it's an important component to be aware of. So as far as the site management for In-Depth Online, a person would go onto indepthonline.org and set up an account for their site or sites. So an organizational admin could be a school superintendent, or it could be a county health department staff, or it could be a judicial system person that's implementing the program for one site or for multiple sites. And we have it set up with that organizational administrator because we have found that some schools want to be able to look at the whole picture of what's happening in their community, not just one school at a time. So there's that top tier of the organizational admin, and then they can assign a facilitator. Maybe they have a separate facilitator at each site. Could be a facilitator at the middle school or a facilitator at the high school, or maybe it's a community organization that's offering the program, and that's another site where it's being held. We do require that for both the facilitated In-Depth program and for the In-Depth Online, that at least one facilitator be trained for that site. We want them to understand the basic foundation about what In-Depth is all about and how to implement it and why to implement it and all the nuances of tobacco and nicotine addiction and all of those things. So we do feel that it's important for at least somebody within that organization be trained, just so they have that understanding. So the organizational administrator, again, then assigns a facilitator, and the facilitator or the organizational admin are the people who then make the referrals to the students. So if a student gets caught and they're brought into the principal's office, that principal could be a facilitator, or they could reach out to the guidance counselor, whoever is designated, and they would be the person that would send that referral to the student. The organizational administrator, as well as the facilitators, then can view a dashboard. That's the portal that allows them to monitor students' progress as they go through. And also, as a part of that, they get some of the students, as students are responding to some of the questions, in particular, what did you find the most interesting about this particular session? It gives conversation starters for the facilitator to have touch points with the student. So the intention with online is not to just hand the student over, put them online and say, finish this program. More so, it's about having the student start the program, and instead of having to facilitate an entire group discussion and holding their hand through the entire process, you can touch base with them every couple of days and say, I saw you made it through session 2. How are things going? Do you have any questions? I noticed you responded this way to this question. Is there anything I can do to help you? So it gives some of that, those talking points. We do also have a conversation guide and tips available to kind of coach and prompt more discussion. If somebody would like to do that as well, just to ensure that the student is not just clicking the buttons through, and they can't, because they do have to complete it, and they can't just enter in gobbledygook, and they do have to complete a knowledge check for each section. So it's not so easy for them to just click through and complete the program. They do have to really focus on it. It is then up to the school to determine what the consequences are for subsequent violations. So, for example, we have some schools that are offering online for the first offense. So as a student gets caught, they're referred to the online program and have to complete that. If they have another violation, then they have to go through an in-person program. But we leave that up to the schools. Students can repeat the online program. Maybe it's a year in between, or maybe it's just a couple of months, but we feel like practice makes perfect. Maybe they need a couple of interventions before it's successful. So, but we leave that to the schools to determine what the consequences should be for violations and when they have fulfilled the requirement or the obligations for that violation. So then the next component of is the student participation. So as I mentioned, they're referred into the program from somebody else, and they receive an email, and then that's how they set up their account. One of the nice things about the online program is that it allows students to start the program almost immediately upon violation. So as soon as they get that email referral, and again, we leave it up to the schools to determine, and we've got samples of these, but what's the process? Does a parent have to be notified? We have a sample letter that can be sent to the parents to say, your student has to participate in this program. Here's why. So it could happen right away, or it may take notification of parents and, school counselors or other people. But that, again, it's up to the discretion of the school for how they determine how that gets rolled out. But ultimately they can start the program. The school can also decide you have 1 week to finish this, or you have 2 weeks to finish this, or instead of having an out of school suspension, you will be in an in-school suspension. And before, the end of the day in this in-school suspension, you must complete all 4 modules. So you can determine what that looks like. Students do have to, as I mentioned, complete a knowledge check that's a 80% or higher, and they're given support to help them answer questions appropriately, but it's challenging enough that it's not too easy for them to cheat to get their way through. And then I mentioned that schools can determine what that time period is. It takes about 2 to 3 hours if a student sat down and went through the program from start to finish. The total time that it would take is about 2 to 3 hours. And again, they receive a certificate of completion. So if they're doing it independently and need to come back to a principal or come back to their counselor just to have proof that they have completed the program, they can have a PDF of that or share a printed copy if need be. So that is available. So some of the online features, as I mentioned, 2 to 3 hours to complete. There are still 4 modules, but it's different than the in-person. So it can't be mixed and matched with the in-person program because the content flow is a little bit different. So it's not as if they miss the first session for the in-person, they can just swap out with the online. It doesn't quite work that way. Again, it is based on the same curriculum and has many of the same content, but it varies slightly in order. And also because it's not facilitated, there's not somebody there to have discussion and dialogue and have those conversations. It's set up a little bit differently online than it would be in an in-person situation. As I mentioned, knowledge checks, there are baseline data and evaluation is built in throughout the program. So we can look at some of the differences from the beginning of the program to the end of the program, et cetera. And they are very similar to the in-person. So we are looking at the same data points when we're comparing the programs. So this is the content. The first section is on getting the facts. It's all about understanding what tobacco is and the truth about all different types of tobacco, not just vaping. And then session 2 focuses more on nicotine dependence and understanding if they may be addicted and how much are they addicted. The third session plants the seeds about alternatives to tobacco use and takes more of a look at goal setting and communication skills and mental health and, kind of planting the seeds for them to quit when they're ready. And then session 4 is really about looking at the past and present, and then from present to future, what would that look like with tobacco versus without tobacco, and then encourages them to take the steps when they're ready to be able to quit. So that's why it's really important to have that the information available about what quit resources are available to them. So I mentioned the adult facilitator training that is required to conduct the program. And that is whether you're offering it in person or if you are going to offer online referrals. We do request, again, at least one person from each site complete this training. This training is free. It takes about an hour to complete. It is offered at lung.training/ I can't see my screen there, but you've got the hyperlink there. A person who is certified as a facilitator is certified for 3 years. Recertification also is free. It's a refresher course that's taken online as well. So real easy to get certified and maintain that certification for sustainability reasons. So quite simple. These are the metrics that we look at. So we partner with the Public Health Management Corporation Research and Evaluation Group out of Pennsylvania. They're our third-party evaluator, and they look at a number of different components of the program, and that's both for in-person and online. We collect some demographic information about the students, and then that includes age and gender and all those things, but we also ask about their tobacco product use, daily and historic. And then we look at some of the knowledge change from beginning to end. We look at motivation to reduce their tobacco use. We do look at, are you ready to quit and when? And so we're looking at their motivation to quit as well. And again, there's our standard that we've set, that at least 60% of the students who participate indicate that they do want to quit by the time they're done with the program. Okay, so here are a couple of resources that are available. The promotional pieces for INDEPTH really focus on adults that are using that would be using the program, because the students are referred into it. It's not like they would ask for an intervention program. So these resources are really more for if you are a health department and you want to reach out to schools. These are resources that you could share with the schools, saying, here's a great program that you can use, and share those. So we'll make those available for you to use. This is the evaluation program for in-person. So there's a pre and post test, or survey, I should say, that the students take, and a pre and a post for the facilitator to take as well. In the online version, it's built in automatically, and the information is available on the dashboard. So we don't have a separate evaluation protocol for online, but there are links for students to complete the surveys and for the facilitators to complete the surveys as a separate component for those in-person programs. And from those surveys, that's where we receive our annual evaluation. So we get the results of the program at the end of each school year. It's been a little difficult the last couple of years with COVID to capture all of that information, and we rely on the facilitators to ensure that the students are taking the evaluation. So we get the information that we're able to based on that, but we're looking to build that evaluation component out and continuing to do that on an annual basis moving forward. This is just a quick little blurb. I guess it's a fairly lengthy blurb about the Lung Association's guidance on vape detectors. Our stance is that we don't support the use of vape detectors when they are used in a punitive approach. Anything that when a student gets caught, they're then penalized for, and we feel that setting up vape detectors oftentimes leads to that punitive effort. It also makes it difficult for students who are not tobacco users to be in an environment where they're concerned that they could be accused of vaping when they in fact were not, and it's just bad timing. So we know a number of schools have invested in them. That doesn't mean that if they have them, they're not allowed to use the INDEPTH program. But when we get inquiries about should we use vape detectors or not, this is the guidance that we share and provide. Prefer that you take that education approach and that those intervention strategies to outline what you can do for students to help them in a non-punitive way. These are just some great resources for anybody really, not just for INDEPTH, but they're good partner resources for other programs and lesson plans and other things that can be incorporated into the school setting, not particularly related to INDEPTH, but supplemental materials that are available as well. An additional resource is our Act to Address Youth Cessation. So this is an online training that's also available that really supports, it's based off of the American Academy of Pediatrics Clinical Considerations for Tobacco Cessation. So that effort is how clinicians can intervene with a student that they suspect is using. So this is a great resource for PTOs or for staff that are, I suspect that one of my students is using, what do I do? It's a great resource for them. We've taken that clinical practice piece and modified it for a community setting or for school settings or for other clinical settings that maybe aren't a pediatric office. So just another resource that can be shared and is available that supports ultimately providing an intervention and supporting students for once they've started to use, how we can help them along their path to quit. This hyperlink takes you to a list of a number of different toolkits that we have available, including Hispanic, Latino, Black communities. We've got a number of different toolkits, and we have one coming for youth as well. So there's a listing of a number of different how tobacco impacts certain groups and what resources are available for them. So encourage you to check that out and visit that in the future. We will let you know as soon as that youth toolkit is ready to launch. And then this is just a brief summary. Oops, went too far back. Okay, brief summary of the resources that I've mentioned here. And what I want to spend the last few minutes is like, what do you need to know moving forward? So how can we help make this happen? So I kind of use the who, what, where, when, how, why, all of those just to give you some talking points and some guidance for if you are working with others and want to grow and implement this program. What do you need to do, or where do you start? So let's start with the who. The who are students, middle school and high school. I did mention that elementary is appropriate as well if need be, but with some modifications. Who are our implementers? They are our facilitators and our organizational administrators. And then, of course, we would want to pull in and work with our administrators as they are working with the school policy piece and also the disciplinary piece and all of those components. So they would be part of who you'd want to bring into the conversation, as well as other school staff, even if they're not making direct referrals, for them to be aware that the program is being offered and how students could be referred into it. What's the protocol and the process for that? We'd want to incorporate community partners. It may be that a school can't implement it locally, but a faith-based organization is willing to do that in the evenings or on the weekends, and they want to offer the program, or healthcare system. Maybe there's a clinic or a health department that is willing to offer the program, and students could be referred into that. We do have some communities where students are fined, again, not our preference for how a violation is addressed. But we've had a number of court systems that have incorporated INDEPTH as a diversion program. So instead of having that fine or that citation, they're given INDEPTH as an alternative for participation instead of paying that fine. Again, an educational approach as opposed to a punitive approach. So that's another group that you could work with and connect with in implementing programs. And of course, we'd want to include parents and families as well for how we can utilize that. So what to discuss? And there's a lot. Again, I want to emphasize that there's a tremendous amount of flexibility for how it's implemented. So it's finding out what works best in your community or in your school. So taking a look at the school policy and does it support an intervention, and how so? And then is that school policy communicated through code of conduct or through extracurricular activities, all of those. So it's just, kind of taking a look at how is this set up, and is this set up in a way that supports implementation of these programs? Talking through, what does the referral process look like? Is it, you're referred to a guidance counselor first or a school nurse first? And then, kind of talk through the consequences. Why are you here? What are the circumstances here? We're recommending that you take the in-depth program, or, here's when the in-depth in-person program is offered. So just kind of talking through what that process looks like, and developing a protocol if there is not one in place. Also worth discussing, what does successful completion look like? They have to complete all 4 sessions and submit their certificate of completion. So is that enough to satisfy? And what's the process to do that? They have to turn in a copy, or is there somebody that's monitoring? Do they have, what's the time period, and when do they have to complete it by? And then, are there touch points? So is it, I'm going to touch base with you twice a week to see that you're making progress or whatever, and identifying what that looks like. Also having a discussion about what subsequent infractions look like. So what happens if somebody violates again, and then, is it a online first and then in person? You've got flexibility with how you do that. Then any additional resources that might be needed, funding to support program implementation, printing, copying, all those kinds of things, which as part of our TA, we can help support some of that. So, and we'll get into that a little bit later. But also very important for what to discuss includes those help resources, because when those students are ready to quit, we want to make sure that they've got resources available to assist them when they're ready. So, and again, where this is, where programs can take place, could be in school, could be out of school, before or after, although that gets to more into why, or into the when. It could be hosted by a community partner within a judicial system, but also where is thinking about treatment options for when they're ready to quit. So all important things to think about before implementing. And then when, again, flexibility, it can be done before, during, or after school. It could be done on a rotating basis. It could be offered once a month. It could be offered, the difference with online is it can be implemented right away, as opposed to saying, we've got such and such a facilitator offering this program on Tuesdays during lunch time or whatever. So, there's just a lot of things to talk through, and we try not to be too prescriptive about how you should do it. Just provide guidance for thinking through and talking through what that looks like and how that might be implemented. And then here's the why piece of it. We want to make sure that we're providing education and awareness, and again, not a non-punitive approach, that we're offering some skill building, not just, using tobacco is harmful and you need to stop. It's more about, how do I build those resiliency skills as well? So it really does address kind of a whole health perspective. It incorporates mental health messaging. And as I mentioned before, it addresses vaping and other types of tobacco, so not just limited to vaping. So moving forward, this is an outline of kind of, we're in the educational webinar and technical assistant call number 1. We're just working our way into that under the grant funding that we currently have. We have one more webinar that we'll be offering at the end of March. So be on the lookout for that. We have received a number of you who have participated in the pre-survey, and we will be reviewing those and starting those technical assistance calls in the upcoming week or 2. So be on the lookout for calls from one or several of us to do that. So this is just a kind of a timeline of what we're looking at moving forward. So our technical assistance, we're offering some, we're starting off with the interest form and kind of gauging where you are, what kind of support do you need? And from that assessment, we'll be able to deliver to at least 6 schools. We'll be providing some support. And again, a customized approach. We know that everybody is not going to be at the same place at the same time. So how can we assist you in working with your administrators or your community partners? Or how can we assist you in looking at your school policy? Or if you already have in-depth started, what do you do to take it to the next level? Or how do you expand to incorporate in-depth online? Those are all kinds of assistance that we can guide. Or maybe you need something else, and we're happy to support that as well. So those are the dates and recordings that we've had thus far. Our next one is scheduled for March 26th from 1 to 2. Hope you can join us for that and be on the lookout for additional information regarding that. Our intention is to listen and support what you need and provide feedback to help you be successful. So whether that's, guidance for policy or implementation or troubleshooting, we're here to support you throughout. So this is the piece. If you have not already taken that pre-survey, I would encourage you to, and we can include the hyperlink either in the chat, or we'll send it with, we'll send it with the follow-up to today. This is the link that gets you to that technical assistance survey. It gives us that kind of baseline where you are and what needs you have so that we can help support you moving forward. And we've had a number of you who have already done that, so thank you. But if you haven't and you want to take the next steps, we want to encourage you to fill out that survey by using that link. So I will, thank you, Patrick. I see you just dropped that in there. And I do see a couple questions in here, so let me go back. Question on age requirement. We are seeing elementary schools seeing this problem of students getting caught with vapes. Can this program be used with this age group? Hopefully, I was able to answer that for you, Berenice. I hope I'm saying that, Berenice. I'm not sure if I'm saying that correctly.
That's correct. Yes, you answered my question. Thank you.
Okay, you're welcome. Is there a way with online to preview the material in the format? Yes, I'm working this week actually on getting a test site so that people can go on and actually run through the program on their own so they can see what it actually looks like. And we also will offer, because we know not everybody has 2 to 3 hours to go through that entire program, just, for fun. And we don't want people to do that to set themselves up as a student because it skews the data. So we're going to offer an outline, a detailed outline of what's included in the program so that you can see content-wise, but also if you want to go on and interact with it and get a sense of what it's like from a student perspective. We are in the process of developing that test site, so be on the lookout for that. How many questions does the pre-post survey have? That's a good question. I don't know off the top of my head. I will say if you contact us at INDEPTH at lung.org, we can send you a copy of a PDF of the in-person pre and post survey so you can take a look at the questions that are on there. We want to be transparent about that. We do just ask that you not use those for paper collection of it. But I know a lot of people want to know what questions are being asked and all of that. So we can get you copies of that information if you need that. And those are all the questions that I see in the chat, unless I missed something, but I will take a pause here and open it up for any other questions that folks may have if you want to come off a mute or if you want to pop it in the chat.
Michelle, I just had a couple questions.
Sure.
I've run into schools that the students are reporting they're vaping THC a lot. Is there any applicability to this program for those students?
I would say yes. We don't specifically go into the details of THC because it can be a really sticky point with the legality of it and everything else. However, if you are looking at the potential for addiction or using, a vaping device that includes that, we do caution for our facilitators that, opening up that conversation with a student in an in-person group program can open yourself up for, having to report it and everything else. So guidance to consider at the very beginning, setting the ground rules of if you bring this up, I am obligated to, to report. We are working on developing some talking points for cannabis as a component, but we don't have them yet. So we do offer some resources. The Stanford toolkit has a great cannabis prevention toolkit. So there are some resources there. We refer folks over to that program and that resource for incorporating messaging if you need it and for background. So I know it's not, people are chomping at the bit to get more, and I wish I had more to share at this point, but we're working on it.
Okay. I had two more. I don't want to take other people's time, but
Okay.
regarding the elementary students, so if you're including students that are, say, 12 and under, and this is trying to motivate students to want to quit, do you have any suggestions for quitting resources? Because every quitting resource I'm aware of is for 13 and up. So if I move them towards wanting to quit and then I got nothing to offer, that's not great.
Yeah, it's a good point. And I will say, even for our program, so for the Not program and Not on Me, they were evaluated. So you'll see it'll say for 13 to 18 or 13 to 19. But again, the tobacco treatment specialist in me says, if they're addicted, we still need to offer them the help. So
share that Excel
may-
spreadsheet with us afterwards
Oops.
to see like who's interviewing what day, just so we have.
Oh, sorry, that's the person behind me.
Yeah. Oh, okay. I'm hearing some background there. That's okay. So there are, I totally lost my train of thought. Sorry about that. What was the question, Ryan?
Oh, yeah, it was about resources for students 12
For
and
students
under.
who are younger. So typically those programs are written for middle school, high school. So unfortunately, I don't know that I have a specific, here's what you do for elementary students or younger students, but again, would say, can you take that information and modify it to use a more simple language to give more relevant examples for a younger student? You certainly could do that, but it would take some modification on the part of the facilitator to be able to do that. But you're going to find that for almost, you're right, for almost all of the programs that are out there, the age is based on the research that's been done and the effectiveness of it for that particular age range and how it was developed. So.
Okay. And my final question was just, so like setting up the account. So say I'm talking to a school principal, I'm just looking at this, and if I was a principal, I'd be thinking, what's the process? And I saw you talk about technical assistance. Anything that you guys do where you could actually walk them through setting up an account, reviewing the dashboard?
Absolutely. When you go to indepthonline.org, there is frequently asked questions, and then there's some additional information. There's a guidance document that walks you through step by step. So you go in and enter the account information, the location and all of that, and it'll give you all of the details for what you need to know for that. So you can find that at indepthonline.org.
Perfect. Thank you so much. I'll take a peek, and that's all I have.
All right, wonderful.
Issues with.
Anyone else?
I have a follow-up question to the age requirement, just because there was a school district that approached us because, it's an urban part of Phoenix, and that's what they're seeing. It's an elementary school district. And I mean, we're just seeing them younger and younger that they're starting to vape. So is there any discussion to start these interventions or these diversion programs at a younger age? Because when we met with them, we mentioned this program, and they're actually really interested in implementing the online in-depth program because they have a alternative learning center. So anyone that gets caught is sent to this center. So they really need something right now. And we're like, the Stanford one also has an age limit of middle school and high school. So it's like, what do we offer these elementary schools that are faced with these challenges?
I know. I wish I had an answer. I mean, it's something that we can explore. We are asking the ages of the participants. And so as we start to see the data that comes in for participation in the program, if we're seeing it skewed younger and younger and we need to make modifications, that's something that we could look at. But again, the evaluation thus far has been based on the target audience for who it was written for. And, I would love to explore that in the future if we have the capacity and bandwidth and funding to look at the effectiveness of a program like this for younger students. Want to be able to provide resources where we can, by all means. I hate to, like I say, don't want to have to say, sorry, you have to wait a couple more years before you can even get into this program. but something that we'll just have to explore moving forward. In the
Would it
meantime,
be-
you can offer it, and it will just take a little more time on the part of the facilitator who's doing the program to circle back with the student, you know.
Yeah.
And I would say for the other piece I do want to say for an in-person program is we do make the recommendation, if you have students who participate, that in a group setting that you keep like ages together. So I would never put a junior or senior with a fifth grader. I would keep our junior, seniors, or high school students together, middle school students together, and not combine them across, you know, multiple years. That allows you to be able to customize a little bit more, and make some modifications. I mean, you look at some of the, you know, the language, the understanding, the examples. A third grader may not have the understanding or the language skills yet to be able to do some of the reading and understanding of what it takes for some of that content. So having somebody that would help them through that would be necessary, rather than, you know, referring them into an online program necessarily.
Thank you. I'll probably be reaching out to you just to,
Sure.
if I have questions, I'll reach out to you, but this has been really helpful. I've learned a lot. Thank you.
Good. You're welcome. You're welcome. All right. Well, we have about 2 minutes left, so maybe time for one more question, is if there is one, but I also want to just highlight on the screen right now, we've got Patrick's email as well as Alyssa's email. And for those of you who have completed the survey, you can expect to hear from us soon. We'll be reaching out to offer some additional support. Are there any other questions that the group might benefit from? Otherwise, happy to have you connect with us individually. Well, I appreciate everybody's time and attention today. Hopefully I've answered some questions for you and maybe planted some seeds for a few more, and that's okay too. That's what we're here for. I'm looking forward to working with all of you in some capacity. Just let us know how we can help, and we will be in contact soon, but please do reach out if you have questions in the meantime. And thank you again, everybody.
Thank you, everybody.